I want to welcome everybody that's here tonight. I know parking was kind of tough. We got a lot of individuals still coming in, but thank you for being here for such a very important subject. And we've got parents, teachers, I see administrators, so we've got a great group here. And we're going to be real informal, that allow any questions that we might have as we do this. But before we get started, I'd like to recognize a couple of people that are here and to thank them. You know, this week, we all agree on one thing: the great publicity that we've gotten from WCTV, the Tallahassee Democrat, all the great stories. You know, when you think about a week of awareness, this has definitely been a week of awareness. And the partnership has never been pulled off like this one has been pulled off here in our community since I've been here, and I've been here almost all my life in Tallahassee. But to see all of our media outlets come together for something that is so important, I think is something pretty remarkable. So I want to recognize a few people that are involved in this. First, is there anybody here from WCTV? If you know, but WCTV has been a partner on this, and we want to thank them for that. Our new publisher at the Tallahassee Democrat, Skip Foster's here. Skip, if you'd please stand. Where are you? Let's give him a big hand. Thank you for this week. Thank you so much. Also, an individual behind the scenes, he never likes his name mentioned, but I think he's the one that's partly responsible for pulling all these media groups together, and that's Ron Sachs, the best communications firm in the state of Florida. Ron, if you'll please stand, thank you for your leadership on this. But as the week has gone by, you know, it's really given me an opportunity as a superintendent of schools to think about everything that we do as a school system and think about, you know, how important our community is to each and every one of us. And as I've been reading the articles that we've gone through during the week and looking at the different events that have transpired, it makes me think of real life, you know, real life situations that we deal with every day as a principal or as a teacher of a school. And something that I always try to do every time we have a loss of a child in this community is to visit the family and to talk with them or to go by and just let them know, you know, how much we care as a school district and how sorry we are, and that we understand that their lives will be changed forever. You know, they'll never be the same as it was before, and we recognize that. And then we start thinking about, you know, recent events when we've lost some of our own students and we've lost family and we've lost friends, and we try to think about, you know, what could we do, not just as a school system, but what could we do as a community to make a difference? You know, what could we possibly do? And what would we place as the value? What we would face kind of as a community, the value of implementing things if we could just change things and maybe save one life. You know, change the world we live in and do something that would just save one life. What would we do as a community? What type of costs would that be worth to our community if we could just do one person? So as a superintendent, you know, I was in the other day and I was in the editorial board with a Democrat, and we were talking, and they were throwing around a lot of different ideas, and we're thinking about what we do as a system. And I think one thing we have to recognize as a school system, that we always want to continue to improve on what we're doing. You know, we're of course one of the top school systems in the state. We're proud of that, but there's more that we can always do. And a couple of things came out of that meeting that I'm going to talk about briefly. Also, what can we do as far as connecting with the faith-based community? You know, Pastor Bill Shiell's here from First Baptist, and he's going to speak. And what we find is there's so many opportunities to partner with our faith-based community. You know, when it comes to what they're doing with the homeless situation in our community, what they're doing with helping others, their whole mission. So I think that's a very important part of this. As I was thinking as superintendent, some of the things that are important, one of the most powerful things that we can offer individuals is education. You know, we've learned over the years that you can't, you know, make somebody afraid of doing something through fear. Fear usually doesn't work. but what can we do related to educating our children? Because what we find with drug abuse and alcohol abuse, it does not discriminate against anybody. You know, you can be the poorest individual in town and have an experience with this, or you can be the pastor at the church and have the same type of experience. So this is something that goes throughout our community. And a couple of things that I thought about with education is, from our school system standpoint, because of this week of awareness and because of what we've watched and talking to my principals and talking to my administrative team, we're going to offer up something different in this community that's done anywhere that I know of in the state. You know, as ninth graders enter in as a ninth grade student, you're required to take a HOPE class. HOPE is part of your curriculum, and it touches on a lot of different ideas. And one of the things that I'm going to offer up, or that we're going to offer up as a community, we're going to put in a 6-week training related to drug and alcohol abuse right in that curriculum, so every student in our community will have an opportunity to have that. And maybe I feel bad about this in a way, but it probably would not have happened if it wasn't for this week of awareness. Because it has made me think, you know, what else can we do? We have this course in place. We have students going into it. Some of them are going to take it virtually, so it's going to be some challenges for them, but we got the best virtual team in the state. They'll come up with it. But if we can offer education to everyone, to our students, because, you know, one of the things that some people are very surprised, a lot of good kids get involved in drug abuse. A lot of good kids get involved with alcohol abuse. This isn't a thing that just affects people that get in trouble. So if we can take all these students as they come in as ninth graders and give them the education and challenge them like we should do all of our student government associations and all of our high schools, that you need to be the leader on this, because the most powerful ambassadors are going to be our students. So that is the first thing we're going to do, and it's come out of this week of awareness, and I'm proud of it, and I know we can make that work. The second thing that I'm going to try, that we're going, not I, but we're going to try to initiate, is moving our safety officers. We have our school resource officers in middle school and high school, and we want to either expand that program over a period of time into our elementary, or either do it through safety officers, so we can start modeling what our sheriff's department is already doing now. They're doing a great job with it. You know, they used to be in the schools to be there just to monitor and for activities, but they actually are teaching now in our schools on a regular basis. So if we can get safety officers into our elementary school and expand this program, even if we do it over time, then we could start an educational component even in our elementary school. So that's another idea that we're going to bring to our school board. So we have 2 initiatives that are in place, but the most powerful initiative to me will be starting with the HOPE program and the HOPE class at our high school level. One of the things that we've also got to do a better job is to make sure that every time we have an issue related to drugs and alcohol, that as a school district we turn that into a teachable moment. That we make sure we turn it into a teachable moment with our students so that they understand where they're going. And one of the components that we have in place that I want to see us expand even further is the counseling requirement for students that get into some type of trouble with this, that we make sure that they have some type of counseling before they return to school, or even while they're returning to school. We wouldn't hold them out of school just for that, but to make sure that we get them the counseling so they understand the dangerous road that they're on related to this. Again, we're only going to be here about an hour, so I'm not going to take all the time tonight, but again, I applaud our community for the way they've come together this week. I think it's made us all think about how we can do a better job as a community. And we always remember that the most valuable resource that we have in this community is our children. You know, they're the most valuable thing we have. So any way that we can protect them and help them and to make sure that we educate them on what can happen, I think is very powerful. Because the biggest problem I see with young people, they think they're invincible. They think nothing can happen to them. And then when it does happen, it really affects their families forever. So we're going to do everything we can help with that. And again, I want to thank everybody for being here tonight. And we're going to have some questions and answers. And this time I want to introduce one of the new leaders in our community, somebody who is really doing a great job, Pastor Bill Shiell from First Baptist Church. Let's give him a big hand as he comes forward.
Thank you so much, Superintendent Pons, and thank you so much for your leadership. What a courageous act to announce tonight that these mandatory requirements for ninth graders to not only through the projects that are already underway, but for drug and alcohol prevention. Thank you so much for your leadership. Just a small part of what we as a non-group were hoping would come out of just this kind of conversation. This group, as many of them are here tonight, is just a group of friends. We are indeed a life group. We are a group that talks about life. And we have been gathering together knowing that some of the best transformation happens not out of data, not out of research, and out of just a policy analysis, but simply out of conversation and friendship and relationship. And we've been talking over the last year together about some of the deeper issues of our community. And it takes a strong community like Tallahassee to, first of all, sit down across the table with people who share life together and just simply admit we have a problem. And we were having one of those community conversations in our home, standing there in the kitchen about 9:30. And as he shared with me some of the concerns that he has at his school and the concerns of his friends, he said, "Dad, I don't have any problem telling you that I've had to tell friends not to come over to our house because they were involved in something that they were not supposed to be involved in." And where we can set aside our pride, our egos, and admit, even together, we can do something about this problem. Our teachers work so hard. Our educators have such limited time in the classroom. Our kids are always stressed and high achievers and working hard. But we as parents can do something, not just about taking responsibility for my child and my home, but to actually step across the comfort zone of my world and to say, you know what? Your child is just as important to me as my child. These are all of our children. These are all of our grandchildren. The reality is the two most public recent incidents in our community, the arrest of the children after this terrible, terrible crime in the Killarn neighborhood, and then the tragedy that occurred in the Rayborn family. Both occurred inside vacant homes. Simply if a neighbor had walked across the street and watched what was going on, we can only imagine if that neighbor might have been able to step in and intervene in the lives of these kids. So all of us have a stake in what's about to be shared with you this afternoon. So first of all, thank you for coming. And then none of us would be here as well without the incredible research of Dr. Karen Cyphers. Dr. Cyphers is the Vice President of Research for Sachs Media Group. She has a PhD in political science, and she has donated so much of her time and energy and resources so that we not only can have the information and data, but also to ask the right questions so that we can have permission to share the information. We are so grateful to our Leon County Schools administration, the principals in these high schools, the students and parents who have been willing to open their hearts and lives to us so that we might listen and learn and then change. So will you help me welcome Dr. Karen Cyphers.
I don't think I need two of these. Hi, thank you so much, and thank you, Superintendent Pons, for inviting me to be here and for making this survey possible to begin with. My name is Karen Cyphers. I am the mother of two preschoolers, one of whom is entering kindergarten next year in Kate Sullivan Elementary. And this whole process has not only been an academic exercise in constructing a survey and analyzing data, but really a hugely humbling experience in watching how data can start some really transformative conversations for people, my own family included. So thank you for that. So as this survey process began, we realized that we don't necessarily know the questions to ask without talking to students and parents who are going through it today. With that in mind, we conducted 2 focus groups, one of students and one of parents. And we asked some questions, and then we asked them what other things were on their minds that we should be asking. We didn't only want this survey to be a dry report on prevalence figures. Those are sort of out there in some venues, whether it's the CDC or through Leon County. But we wanted the survey to touch on what the challenges are that kids are facing with their own peers, challenges that parents face in talking to their kids and talking with other parents especially. So 503 parents completed the survey. They were recruited through listserv emails through school principals, and 540 students completed the survey. They came through both listserv emails as well as social media, with the idea that students might be more willing to answer questions honestly if that email is not coming from their principal. So a few major takeaways to keep in mind as I go through the slides, and I can see, even with the lights, I can see well enough to see a hand go up, so don't hesitate to interrupt me if there's something that stands out to you that you want to ask a question about. First off, as expected, there's a very significant disconnect between what parents think and what teens are reporting. There's also surprisingly wide variation in parental views on what's appropriate alcohol use by teenagers. The survey findings have wide implications for law enforcement, parents, clergy, teens, you name it. And the message that I think we're all sort of walking away with is, well, what you're about to see is highly compatible with the data from every other community in Florida and across the United States. Our hope is that Tallahassee's response can be better. All right, so we asked students whether or not they had experimented with alcohol, and we asked parents whether or not they believe their child has done so. 40% of students and 46% of older students reported experimenting with alcohol, compared to about a quarter of parents believing that their child had done that. This year represents, it couldn't look like a more perfect incline there, the prevalence of frequent drinking, which we defined as a student reporting that they drink at least every month or more. So while 5% of 9th graders report drinking frequently, over a quarter of seniors do. But I want to caution one thing in looking especially at the 9th grade number there. It gives somewhat of a false sense of security, thinking that this is not something that's touching most early high school students. In our conversations and focus groups with students, we hear that in middle school is the time that a lot of students become exposed for the first time, and the pressures are there even if they're not reporting it. We then wanted to know, what level of concern is what are kids feeling about their friends, and what are parents feeling about their child's friends? There's a lot more parents who either feel or are willing to express concern about alcohol use among high school students. And nevertheless, though, it says something that about a third of high school juniors and seniors are feeling some level of concern for their peers as well. This slide really, I spent a lot of time thinking about these numbers here. A third of parents believe that most of their child's friends, at least half of their child's friends, are drinking monthly or more. About the same ratio of students are reporting that at least half of their close friends are drinking monthly or more. What this says to me, and this is something that I think would be an interesting conversation to happen later, is that parents are fairly on target about what groups of friends are doing. But if you think back to the prior slide, most parents don't think it's their child. So, I think there's a fantastic opportunity for discussion where parents have a realistic view of what's happening to some extent among groups of friends, but they have a very distorted view of what their own child may or may not be doing. Further, 67% of students report that at least half of their peers drink monthly or more, not their close friends, but their peers more widely, which I think may reflect the likelihood that students are allowing maybe more isolated incidents to stand out in their minds, and the idea that everyone else is doing it even when perhaps they're not. Similar to the last slide, this one here describes the percent of parents who believe that at least half of their child's friends are doing drugs every month or more. Again, it's fairly consistent between parents and students in terms of that impression. Again, I think this raises a fantastic opportunity for parents to be talking to their children not only about what the groups of friends are doing, but what those kids are involved with personally. Then we asked students and parents about how much they believe alcohol is present at parties. I want to focus mostly now on the juniors and seniors column, but we can talk about younger students as well if you would like. About 70% of juniors and seniors report that alcohol is always or nearly always present at parties that they attend. That is about double as great as parents' perception of alcohol prevalence at parties. I didn't include, for the purpose of space here, the ratio of students who report that alcohol is never present at parties, and those numbers were very small, especially in the later years of high school. Likewise, we asked about the prevalence of drugs at parties that are attended. Again, it's lower in prevalence, but the pattern is the same, where students are reporting double as much access to drugs or presence of drugs at parties as parents believe there is. It turns out that, when we're talking about drugs in this survey, we're really talking mainly about marijuana and and to a lesser extent, but pretty significant, about prescription medications, both attention deficit disorder, the ADD, Adderall drugs, and pain medications that are not prescribed for that child. 58% of parents believe that it would be very easy for their child to get marijuana if they wanted it. That jumps to 62% among parents of juniors and seniors. Similarly, 63% of all students report that marijuana would be very easy for them to get, and that's 3/4 of juniors and seniors. I should note that as the green boxes appear, in the surveys we gave students and parents an opportunity to offer their free-form thoughts, uncensored, and these are verbatim responses that were given to us in the survey. They may be difficult to read, but in this case, parents are acknowledging, the top one there says, "My child gets weed at school daily." There's absolutely an understanding among parents, it seems, that marijuana is pretty prevalent. This chart just represents all the drugs that we asked about. And this is where we have the feeling that it really is marijuana and pills that are driving the drug use recreationally in our high schools at this point. All right, then we ask teens, where are you drinking when this is happening? And I highlighted in yellow just to try to draw your eye, because there's a lot of numbers on a small screen. The areas that seem to be the most common, not surprisingly, it tends to be homes where parents are not present. But I want you to also look at the gray shaded area that refers to at home with friends with parents knowing. And that prevalence is 16% among all students, 17% among juniors and seniors. Another area that I think is important to look at is anything to do with cars, whether driving or parked. Those are not insignificant figures there as far as teens drinking in vehicles, whether they're driving or whether they're parked. That parked car will be driving. Then we asked teens where they were getting the alcohol. Not unsurprisingly, again, older friends are the most common source of alcohol. We live in a town where there's 4 colleges, and it's not surprising that high school students have friends who have already graduated who are still in town and may have easier access. But certainly that's not the only place. About 36% of high school juniors and seniors report getting alcohol from their parents without their parents' knowledge. And not insignificant numbers are accessing alcohol from convenience stores or other stores with a fake ID or theft or without a fake ID at all. Then after sort of getting students' takes on that, we wanted to get a better sense of how parents felt about providing alcohol to students or alcohol use among their teens in general. We asked parents to identify which of 3 statements they feel they can most closely identify with. The majority, 62%, most closely identified with the statement of, "I do not allow my child to attend parties where alcohol is present." About 30% said, my child attends parties where alcohol is present, but I trust that he or she will not drink. And about 10% most closely identified with the statement, alcohol is going to be present at teen parties, and I trust my child to drink responsibly. Then we tried to get at the same dynamics through a slightly different angle. We asked parents to identify with one of two statements. The first one, under no circumstances should my child drink alcohol. 58% of parents identified most closely with that. And 42% of parents chose, most teenagers try alcohol and I would rather they did it in a safe setting. But then in the next question, only 18% of parents agreed with the statement, if you suspected that your child would be out drinking, would you permit him or her to drink in your own home instead? My one possible interpretation that I had, and again, this is just my read of, sets of numbers, it seems that parents, the 42% of parents who believe that their child will experiment with alcohol and want them to do it in a safe setting, almost none of them want that safe setting to be their own home. And it creates sort of a prisoner's dilemma of sorts. To me, it says that there's a portion of parents who know what's happening, don't want it to be in their home, so they turn a blind eye on where that will be. In terms of, the idea of parents knowingly giving their child alcohol, 14% of parents reported that they had done so, that they allow their child to drink in their home while adults are present. 26% of students, however, report that their parents have permitted them to do so with parents present, and that jumps to about almost 30% among juniors and seniors. 3% of students said that their own parents have supplied alcohol to them and their friends, but 15% of students report that their friends' parents have done so. So again, your friends' parents, your parents, the point is parents are involved, at least in an extent that's pretty meaningful for a conversation. This last stat here is something that I don't know how to interpret, and I don't know what the implications would be, and I don't know if there's any actual practical use for this, but 63% of students said that if their parents would allow them to drink responsibly in the home, they would be less likely to drink irresponsibly out of the home. And I wonder if maybe some of the students and some of the parents share that sentiment, and the way it's approached is to provide it and then look away, or provide it and hope that while your child will be safer staying in the house, that doesn't make their friends any safer when they leave to drive home. Yes. That makes a lot of sense. Yeah. It's interesting that that's what students feel. Again, that's what they say. That's right. Yeah. Right. So we noted before that over a third of students report that it's common to access alcohol from home without a parent's knowledge. Comparatively, less than 10% of parents suspect that their child or their child's friends have consumed alcohol from their home without permission. So again, there's a disparity in what parents and students perceive to be the case. 63% of students said that there's alcohol present in their home and is accessible. About a quarter of students said that it's there but it's locked up. And 12% of students said that there is no alcohol present in their own homes. Here's another area where parents and students feel very, very compatibly with each other, and it regards the perception of peer pressure in high school about drinking. These are non-significant differences here between parents and students, and what this shows is that both parents and students are reporting comparable levels of the perception that their kids are being pressured to drink or have experienced that before. And for all age levels, it sort of averages out to be about a quarter. Then we asked parents whether or not they've ever avoided talking to another parent about a child's alcohol or drug behaviors out of fear that there might be social repercussions to their child for doing so. 16% of parents said that that had been the case for them, jumps to 21% of parents of juniors and seniors. And comparatively, nearly 40% of students report that they have avoided reporting another student's drug or alcohol use because of social repercussions on themselves. Then we asked parents, how often do you call ahead to your child's friends' parents when they are going over for a party, sleepover, you name it? Most parents report that they call most or all of the time, although that drops a lot by junior and senior year. Only about a half of parents said that they do that for their older high school students. Just 41% of students believe that their parents make these calls most or all of the time. It doesn't mean that students always know when their parents are making the calls. We asked parents also whether or not they would inform another parent if they had learned that a party involving drugs or alcohol had occurred at that parent's house. 91% had said yes. And if a platform existed for parents to share information confidentially, perhaps in a way that might avoid those social repercussions that seem to be a major inhibitor, about 88% of parents said they would use it. So things are a little bit less certain for teens when it comes to the likelihood of reporting problems when they see it. We asked students if they would intervene if they saw a peer drinking to excess. While on average, 73% of teens said that they would do that, absolutely or probably do that, those numbers look a lot different when you break it out by the possibility of how often that child is drinking. So among students who don't drink monthly or more, 75% believe they would intervene in that circumstance. That drops to 51% among students who are actually participating in these activities most often. And there's various explanations for that, including the one that students who aren't experiencing this yet may underestimate the difficulty of actually confronting problems when they see it. This one, I think, really cuts close to the heart for a lot of people, and this one regards whether or not students feel comfortable reporting or intervening if they see a friend drink and then drive. Again, there's a big difference between students who are drinking more often and students who aren't. 51% of students who drink monthly or more said they would absolutely intervene. Another 37% said they would probably intervene. But that's a substantial difference from the 78% and 17% of students who don't drink monthly or more, who believe they would intervene in that circumstance. And I think this speaks possibly to the need for more conversations with students about how to feel confident intervening when you know something could hurt somebody, especially when the hurt person may not be the one drinking, which is what happens in the event of DUI. So this slide here, I hope, is one of the main ones that we'll see some substantial change in over the years, thanks to the policy that was announced just now regarding a huge drive towards education, especially of ninth graders. Students have a lot of mixed experience in terms of how much education they feel they have received from the school system. 19% of all students feel they have gotten quite a bit, bringing the total for some and quite a bit to just under 60%. That number, as you can see, is higher for the students who go to private school than public school, and I think that's an area where we will see a big jump in the next few years, and that's fantastic. The last slide here, we asked students regarding marijuana in particular where they were getting the most information from. This question came out of our focus group with students, where students reported that it was drug-using classmates, particularly the straight-A students, the smart kids who are using marijuana and sharing with other kids that it was safe for the brain and it could be done without harm. So we asked students in this survey where they were getting the majority of their information about marijuana from regarding its impacts on health or mental function. Classroom teachers and drug-using classmates are statistically tied for number one in this case. And that is it. Thank you.
Great job. We're going to have one more speaker, then we're going to take questions with the whole group up here. This time, Shauna Blakeney from the trauma program at Tallahassee Memorial Hospital. Let's give her a big hand as she comes forward.
Good evening. As he said, my name's Shanna Blakeney. I'm the trauma program manager at Tallahassee Memorial. And we have a program called Pathway to Preventions. A lot of you may be familiar with our actual simulation event that we do with Operation Prom Night. And that is, as I just said, a simulated event where we actually go out to the high school and the students often participate. We have local EMS, fire department, police department, and it's basically a reenactment of an accident involving alcohol around prom night. But we even take it a step further, because as we know, there are other very serious issues other than alcohol, and that's texting and driving, distracted driving, where you have multiple kids in a vehicle where they're not paying attention, putting on makeup, eating. We could go on and on about all the things, even as adults, that there's an issue with. But we also have a program where it's more of an awareness. It's a presentation where we go into the schools of all ages, elementary, middle school, high school, and talk about some of the dangers of injuries from anywhere from bicycles, ATVs, texting and driving, drinking and driving, sports. It goes on and on of what we can do. And we do any age, any size. We can start with a classroom of 30, or we can do an entire school. We actually will be doing our first school, we're very excited, at Mumford Middle School, and it will be with distracted driving as our topic. Because I do believe, as you've said already in 9th grade, when you're already seeing issues, that starting even in middle school is an excellent idea. Sometimes I wonder if the earlier you start, the more influence you can have on them. As a mother of 3, I know that my children, even at age 5, will correct me if there's things they think that I'm doing. Don't answer your phone. Don't talk on the phone when you're driving. So I believe you're never too young. And the reason we're doing this is we live this every day. We see multiple trauma patients at the hospital, and we meet every week with our medical director over trauma, and we discuss cases, and it just is very heartbreaking to see some of the stuff that we see and know if one thing was done different. One little, a seatbelt was on, there was no drinking, just the little things, one simple change, and this would not have happened. And so we take it upon ourselves to reach out and say, what can we do to help you? How can we partner with the different people to just make a difference? And that's exactly what we want to do. So thank you very much.
Testing. All right. I'm going to ask if the panel would come back up here with me. We're going to be real informal, but just one of the things, I started doing these community conversations almost 9 years ago, and one of the things we like to do is to see if we have any questions that anybody might want to answer before we finish up. I do want to recognize Assistant Superintendent Scotty Crow, Divisional Director Alan Cox, and thank them because they're the ones that really worked with me today to help me to think of a way that we could put this training back into our schools directly. And again, Alan's done a lot of work statewide related to health education and the lack of it, and how we need to have more education. And Scotty drives the curriculum for our entire school district. So thank y'all for this today because I think this is going to make a big difference. Anybody in there? Chris, you got your hand up. Does that mean you have a question? No, I'm sorry. Okay. Questions from some of our right here. Yes, ma'am.
My question is, when I'm overlooking a lot of surveys before I use something from last year, that survey bomb, I noticed that a lot of kids mention that they can talk to parents and go to talk after, or like talking when they're disconnected, so they can express what they want to. So what would you say to that? A lot of them are talking to kids, telling kids. Kids kind of want to talk to their parents or something, but they just feel like they're not going to be able to see well, or they don't think it's
Who would like to take a stab first? Michelle?
What's the question?
We'll go read it out again. Good.
Her question, and I'm Michelle Euban, I'm a partner at Sachs Media Group. I work with Karen and it's been a great privilege to do this work and to help create some educational materials for parents and teens that hopefully will help the dialogue between parents and teens. The question was, a lot of teens say on surveys that they feel like they don't talk to their parents because their parents talk down to them. I'm a mother of 6 who've all gone through Leon County schools, Rudiger, Kate Sullivan Cobb, and Leon. I'll have 2 at Leon next year. But, part of what we heard from mental health professionals and others who work with kids is that it is important to keep an open dialogue long before adolescence comes, to have a safe zone to talk about anything. And as it relates to this topic in particular, for parents to have an honest conversation with their kids and express what they hope their children will do, to acknowledge that they face peer pressure, to acknowledge that it's scary for parents because they love them so much and they know how much is at stake. And then to think through with their children scenarios where they help them envision, well, what would you do if you went to a party and the person who drove you there started drinking and that was your ride home? You know, if different situations come up, to give them a chance to think through in advance and to brainstorm with them. So it's not just don't do it, but, you know, I'm afraid for you, I care about you, and let's figure out together how you might handle the situations that could come up. And with that, does anyone would like to add?
Great question. Yes, sir.
What do we know about prevention through education? Are there certain educational approaches that work better than others? How does the school system decide which curriculum to use?
I'm going to let Dr. Cox right behind you stand up and answer that because Alan is working with me on that along with Scotty. Go ahead, Alan.
Yeah, that's a great question, and you just answered it. Those type activities that require role play, refusal skill type activities, and scenarios where you actually put the kid in a position where he's got to say no, he's got to develop strategies to get out of that. That's what makes the difference. What makes the difference in education is day-to-day instruction, just like we do reading, math, writing. So think about health education now. You've got the cognitive component that you have with all the other areas, but you also got a behavioral change you're trying to make, right? So those kind of things, your movement, Jackie, to take a 6-week, almost a quarter of the school year, and to condense it to substance abuse and what I call prevention education is huge. That is what makes the difference.
Thank you, Alan. Yes, right here.
My name's Daniel Reservoir, I'm state vice president for staff, Florida Student Constructive Decisions. And I just wanted to, thank you. I just wanted to add to that all surveys and all reports indicate that parents are the #1 influencers on teens. So I am so grateful for this conversation that we have going and to see all your parents in the audience. And despite what your teenager might act like, and you know it's their job to make you think that they're not hearing a word you're saying, but they are. The long-term ripple effect comes from you, and not only what you say, but your behavior. So when I'm talking to the teens in SAD, the thing that I hear from them is, Mom tells me that I shouldn't drink and drive, but she had wine at dinner and then she got in the car and she went to the 7-Eleven. So not only is it your word, but it's your actions that are going to have a long-term effect on your kids, whether you even think it is or not. It really is.
And one thing to add to what Alan said too is what we found out anytime we change our curriculum, no matter how we're changing it, that we have to do professional development with our teachers. You know, because that's the most important buying group. We've got to get them, and they always make the adjustments. So we'll be providing the type of professional development through Scotty Crow, our Assistant Superintendent Allen, to develop this curriculum and to make sure that our teachers are trained in order to add this in, because this is a paradigm shift for us. Yes, ma'am.
I'm Gina Davidson. I'm a Leon County school teacher. I teach 4th grade, but I also have a freshman at Childs, and I have a 7th grader at Deer Lake. And I'm very familiar with all these issues, and I actually had Ansley Ray born when she was in 4th grade. Oh, hello, Mrs. Prince. And I have her sister now, so I'm very connected with everything that's happening. I think it's great that you're doing the 6-week program. I'm thinking my son's going into as a sophomore, so I hope he'll somehow still get that in his Hope class. And then I also know that my son experienced these things, at Deer Lake Middle School, and I know that that's not uncommon. And I'm kind of looking for that bridge between teaching 4th grade, where they are so diligent, and like someone said, they're telling you what to do, and they are. And I think in 4th grade that they do have that. And we have Red Ribbon Week, and we talk about it. And when I look out at my 4th graders, I tell them sometimes, these are the things you're going to encounter, and I think they don't believe that they'll encounter it, but then on the flip side, by 8th grade, 7th grade, they have encountered it. And so I'm just hoping that maybe there can be that bridge there in middle school where this type of program can also be available to them even before they hit 9th grade, because I know my son, when he hit 9th grade, he was already there.
And that's a great question. And one of the things that we're going to seek to expand is the great partnership we have with the Sheriff's Department and with our resource officers doing a lot of training and doing teaching classes. I'm hoping we can really, even though they're already doing some of this, I think you're right. We've got to hit it in middle school. And at one time in middle school, I even had a course that we taught at Deer Lake that we did for drug education. And then as time's gone by, you know, with tough budgets, it's always excuses, but we need it, and we need it everywhere. And again, to make sure that our children realize how dangerous this is. Because a lot of times kids get into this, and it's almost through peer pressure, and then it's something that they had no idea what they're into. So it's a great point, and we'll work with the Sheriff's Department on that through our SRD program. Question right here. Yes, ma'am.
Yes, hi everyone. I'm Sophia Ram. I'm the program specialist with MAD, Mothers Against Drunk Driving. I just wanted to say I think it's amazing what you guys are doing, and we're so happy that the survey came out and was able to show those results and things that are going on. MAD does do, you know, a Power of Parents program as well as a Power of Youth program. We are actually at some of the schools already, and we would definitely love to be a part of your 6-week program somewhere in there as part of the presentation or whatnot. But we have also established a Power of Youth program as well as a Power of Parents program for the middle schools. So we do have materials that we would love to give to the schools for you all to distribute, you know, of course, once you have approval, to be able to give to the parents as well as the students so that that word does get out, because it's very important. A lot of times going to the schools, actually just left Child's High School 2 weeks ago, and one of the biggest things that they said there was, well, what my mom doesn't know is I hear her talking to me. So sometimes when I'm at the party, it's her head, it's her voice that's playing in the back of my head that's saying, don't touch that drink, versus the parents that are saying, she doesn't hear me. You know, she doesn't know what I'm saying. She's not even listening to me or what day-to-day clothes to wear. However, they do hear you, and the parents are a very major part, as well as the teachers and different things of that nature. So I'm so happy that you all are doing what you're doing, and keep up the good work.
Thank you so much for that. And what we find out in the school system, if you've ever been involved with discipline, that most of the problems that we solve usually comes from the students themselves, you know, and they're the most powerful group there. That's why any way, you know, and Alan and I'm sure Scotty, and we'll have a whole group working on this, but any way that we can empower students to take responsibility not only for their school but for their friends. It's just like getting in a car and you're seeing somebody driving and they're texting, and you know that's to stop that and to speak up. And I think the survey shows that. And the most powerful ambassadors we can have, we know our teachers are important, and we know how important our parents are in the schools, but also our students, and they've got to come along with us on this. Other questions? Yes, ma'am.
Good evening, y'all. My name is Lisa Sherry, and I work at Disc Village, and I am the Juvenile Services Supervisor. That program encompasses not only the Juvenile Assessment Center, where every youth in Leon County goes when they're arrested, but also the Juvenile Drug Court Program, the Civil Citation Program, and the Juvenile Outpatient Program. What we do is we provide substance abuse services and mental health services, if the youth has substance abuse issues, to kids in our community. And what we're trying to do is provide them with comprehensive information, counseling, and services, as well as a monitoring component, which is that urinalysis screen. So many times people are getting a counseling services, and the parents will call me and say, well, my child is in counseling, but they're not getting that monitoring component, and that's an important part, because that allows us to know where they're at and what they're doing, as opposed to just what they're reporting. The other thing we do is provide that educational and counseling component when kids are suspended. So what happens is they get caught coming back from campus and they've been drinking. Well, they don't have anything on them, so they haven't been arrested or cited, but they're getting suspended. And then the school system will sometimes say, well, you'll get a 10-day, but we're going to reduce it to 5 days if you go and you get this counseling program. That's not consistent, but we're very hopeful that we can work together to be able to provide that. We're not the only provider in town. There are other juvenile programs in town that provide substance counseling, but we are here. We've been in this community for over 40 years. We have a comprehensive prevention program that the Leon County school system has allowed us into 5 schools, providing prevention services to middle school and high school kids as well. So we have a lot of information. We are here for you. We are here to help you and your kids. And I brought some program information. If any of you all would like it, I'll be happy to hand that out. So I just wanted to give you that information.
Back, in the back.
Yes, thank you very much. That Pastor Shield's got the microphone there, and my question is directed toward him. I appreciate what's going on in the schools, but an even more informal setting other than a teacher or a guidance counselor at school providing education about these topics is a youth group director at a church. And the church that I attend, we're getting a new pastor here within the next month, and that would be something that I would like to approach her to become involved in. And I'd like to know what your plans are and or your thoughts on providing it to a church youth group, which both of my sons are involved in at Grace Lutheran Church.
It's an excellent question, and we had a wonderful meeting this afternoon with Tallahassee Interfaith clergy and making them aware. Certainly this past Sunday in my congregation, I know Rabbi Romberg will be speaking about it this Friday night in his, and many others will be speaking over the next couple of weekends. And you alluded to this, and Dr. Cox did as well. It takes not only a pastor to give the congregation permission by speaking and preaching about these issues, but then also youth directors granting permission to speak with parents and saying, first of all, we need to create a safe space amongst the faith community to talk about these things. Many times, we in the faith community come to our congregations to get away from what we perceive to be problems that are, quote, out there. And the research reveals that the problems are amongst all of us, and all of us have these struggles, as well as those who do not and are not faithful in a faith community. I can't tell you the number of evangelical and faith-based groups that are involved on our campuses already and working in lots of different issues and making an incredible difference in our community. However, this happens to be one that transcends and crosses all kinds of barriers and boundaries. So that's the first thing. The second thing, I think, is something we did at First Baptist just a few weeks ago. We were delighted to have Justin Tate come, and he shared his story. I believe you'll see tomorrow some reporting about his story. And his is just one of several tragic examples, but also someone who is willing to talk about the dangers and the decisions and the high-risk behavior. I can share with you, having talked with President Thrasher at Florida State, he's dealing with many of the same issues. Anything that creates a forum that leads to what Dr. Cox said. Okay, let's have some role-playing. Let's have some conversation. Let's sit down and create a space. And oftentimes, the faith community can be the space where a parent can talk and a student can talk and they can share together. Because one of the things that I think we should not miss here in Dr. Cyphers' research, in addition to all the wonderful perspectives shared about the importance of parents being involved with their students. But one of the real gaps we have right now is the gap between parent-to-parent communication. And some of that is related to what goes on in households. There may be multiple people who are involved in the parenting of a child. And so there are many, many texts, cell phones and cell phone numbers that need to be exchanged. And there are lots of conversations that have to happen. But, you know, for instance, in our neighborhood, we have to have this open agreement about, okay, is alcohol a part of your home? And is it going to be present where my child is going to be? And who is going to be present and who is not? And are they leaving? And obviously, when we introduce those conversations to other parents, many times we're considered to be the, quote, the bad parent. Because oftentimes, in some other households, not necessarily in our neighborhood, but in neighborhoods of households of other folks in the school we're a part of, that is not practiced and those values are not part of their household. So we have to make it very clear before these conversations happen. But I can tell you this past weekend, I had 2 children dropped off at my house to play with our children, have a great time, and for both of those households, neither parent got out of the car to introduce themselves to us. Now, maybe they just kind of knew who we were, and so they kind of trusted, you know, hey, okay. But the reality is, just you would think normally, hey, you know, if I was going to drop my son off at your home, I'm going to get out, say hello, how are you doing, what do you look like, what's your last name, anything, you know, what's your phone number. So I think I'm not wanting to cast aspersions on any group or anything. However, this is a parent-to-parent issue as well. In addition to the fine work that our principals and educators and administrators are working on, I can be heavily invested in every little detail of what my child is doing, but I failed my child if I haven't talked to another parent.
Well, I think
We're going to wrap it up. As we do this, again, I want to thank all of our partners that have helped us with the Week of Awareness. You know, you think about it again, WCTV, the Tallahassee Democrat Media, Ron, all your team, Michelle, just, I mean, this is valuable information, and I think when we get information like this, we find out why we live in a special community, why we have a special school system, that we're going to take some action to try to do something about this together. So again, thank you all for coming. It's going to be a great week of awareness, and I hope we're going to learn a lot about this. And again, let's do everything we can as a community to protect our children and keep them safe. Thank you all for coming tonight.